Okay, here is my 360 of the room. So my first step would be to verify the provider's orders and starting an IV. So I verify those orders. I would walk in, provide for privacy for the patient, and perform hand hygiene. After all that's done, I will then introduce myself to the patient. Hi, my name is Kylie and I'm a nursing student. And then I want to verify their ID. So can I have your first and last name, date of birth, and do you have any allergies? Okay, so patient has verified their identity. I would also be holding the MAR against their bracelet, checking to make sure that both of those line up. So patient has verified their ID. So now I'm going to explain what I am here to do. So your provider has ordered to start an IV. So I'm here to do that for you. Is that all right? Okay, so the patient has consented for me to start their IV. Then I would want to explain any signs and symptoms of complications with an IV. So some signs and symptoms that you could experience in regards to any complications with your IV would be any inflammation, like redness or warmth around the insertion site, any swelling, any drainage out of the insertion site. So if you have any of those symptoms during insertion or over the next couple days while you have the IV, just let me or someone else know, okay? So I've explained to my patient some symptoms to look out for with the IV. All right, so now I would want the bed at an appropriate working height. So the bed is raised to an appropriate level for me, ensure adequate lighting. I would also ask about hand dominance. So if the patient is right-handed, I would maybe want to assess first the left hand and arm to see if I could access a vein there so that they could still use their dominant hand freely. And then I also want to avoid any surgical sites too. Okay, so now I am ready. I am going to assemble all my equipment. This is going to be my table. I would wipe down this table before I would lay out all my equipment. And I have a pad under my patient's arm, and I have already placed that. So I'm just going to go ahead and open my equipment. Okay, so I'm going to go ahead and take my tourniquet, and I'm going to use this first to assess where I want my IV site to be. So I'm going to place it to the top of the arm. I'm going to have their patient move their arm about right here. Okay, palm side up, and I'm just going to place the tourniquet under their arm. Okay, so I've placed the tourniquet, and now I'm going to feel on the arm for a good insertion site. Okay, so as I'm tapping this vein, it's bouncing back. It seems like an appropriate insertion site to use. So let's pop that tourniquet off. Leave it right here. I would instruct the patient just to relax, and I'm going to set up the rest of my supplies. So I'm laying out all my supplies. Next, I want to go ahead and get my extension set ready. So I'm going to get my normal saline. I am going to read the label, make sure that this is what I think it is. So this is normal saline, 10 milliliters. And then I'd also want to check the expiration date, make sure it's not expired. So this is not expired, it is good to use. Go ahead and open it. Take the cap off. then I want to get rid of any air bubbles in the syringe as well. And ideally, I would do this over a trash can. Okay. I'm going to set this back down on the packaging. And then I'm going to open my extension set. I have my extension set. It is unclamped. So now what I want to do is go ahead and attach the normal saline to the extension set, so that way when I'm ready to attach it to the IV site, it's all ready to go. Okay, so that is attached. So I'm going to go ahead and remove this cap. And I want to make sure that this end doesn't touch anywhere that isn't clean. And then I'm going to prime my extension tubing. Okay. So this is all ready to go. No air bubbles. Saline is flowing through the tube. Good. So I'm going to lay this back down on the packaging, ensuring that it doesn't touch the table. Okay, so now that that's ready, I want to go ahead and get everything else laid out because we're about to cleanse the site. So I'm going to get my needle catheter. Lay that out on my table. To clean my gloves and my tubing. So now that I have all that laid out, I am going to apply the tourniquet and cleanse the site. Okay, so now that the tourniquet is on, we will cleanse the site. And we're going to just go in circular motions for about 30 seconds, starting inward and then working outward. And then after it's been 30 seconds, I'm going to allow that to air dry. I'm not going to blow on it or fan it, and I'm going to apply clean gloves. And then I am ready to start after it has dried. Once it dries, I will remove the cap. I have located my IV site. I'm going to pull back on the skin. I also want to make sure my catheter is intact, so my catheter is intact. I'm going to pull back on the skin I haven't cleansed, and I'm going to insert the IV at a 10 to 30 degree angle with the bevel up. Okay, so I've got blood flow. I'm going to pop that tourniquet, insert the needle about 1/4 of an inch more, and then I am going to advance the catheter. Okay, I have advanced the catheter, so now what I'm going to do is I'm going to apply pressure to the vein above the insertion site, and then I am going to remove this. And I activated the safety on the needle. I'm avoiding touching the insertion site. I have my needle, and I would put that in the sharps container. Alright, so now my extension set is attached to my IV site, so I'm going to aspirate. Okay, there is blood flow back into the line, and then I would flush with 10 milliliters of the saline So for the purpose of this video, I'll just flush a little bit. Okay, I would flush all that slowly. I'm looking for any swelling at the insertion site. There's no swelling. Insertion site looks good. So now that I have flushed all 10 milliliters, I'm going to apply my clamp. Okay, so the line is clamped, and I'm going to remove the saline. Okay, my insertion site still looks good, so now I'm going to apply dressing. So I'm going to take my transparent dressing and I'm going to apply that over top of the insertion site. I want to make sure that I can still see the insertion site, but that it is completely covered. Okay, so that is firmly secured. So I'm going to peel this off around it. And then I'm going to apply the label. And then I want to tape down the J-loop so that when the patient is moving, it's not moving with them. So we're just going to take J-loop, we're going to attach it just like this. So it is firmly secured on the side of the arm. And then I would write the gauge, the date, the time, and my initials. So the IV is labeled with the gauge, date, time, initials. The extension is secured. Insertion is taped down with the transparent dressing. So I would lower the bed back all the way, make sure side rails were up, and instruct the patient to let me know if they experience any complications with the IV. And then I would take off my gloves and go document. Now it is, I'm just going to use the same set of gloves. Okay, so now let's just say it is 3 days later. So the provider has ordered to discontinue the IV. So same steps as before. I'm just going to verify that the provider ordered to discontinue the IV on my patient. I'm going to walk in, provide for privacy, perform hand hygiene, and then I want to introduce myself to the patient. Hi, my name is Kylie. I'm a nursing student. Verify their ID. Can I get your first and last name and date of birth? And do you have any allergies? Okay. And then I'm holding the MAR up against their ID band, making sure that both of those match up. They do. And then I'm going to explain what I'm there to do. So your doctor has ordered to discontinue your IV. So I'm here to take that out for you. Is that all right? Okay. Patient has consented to me discontinuing their IV. So I'm going to go ahead and put on gloves. I am going to remove the tape that's on the extension set. And would have a trash can right next to me as well. Okay, and then I'm going to remove the label. And then I'm going to start removing the dressing, and I'm going to do this by stabilizing the catheter and pulling outward, letting air get in under that transparent dressing, and loosening it up from the skin. So I'm going to do that on the other side as well. Okay, so I have stabilized the catheter and removed the transparent dressing. So while the catheter is still in, I'm kind of looking at the IV insertion site, no abnormalities. So I'm going to grab my gauze and I'm going to remove the catheter flush with the skin and apply firm pressure. Okay, I'm applying firm pressure with the gauze. I want to check the catheter after I remove it, make sure that it's still intact, no damage, so this one looks good. Then I'm going to look at the insertion site again. No signs of infiltrations or hematoma. All looks good. I would ask the patient, are you experiencing any discomfort or pain? They state no. So now I want to apply a pressure dressing. So I'm going to leave the gauze on the arm and apply a pressure dressing. So this is to ensure firm pressure on the IV site. And then I would leave that on here for 15 minutes. I would let my patient know that I'll be back to check on them and to leave the pressure dressing on to let me know if they have any bleeding or pain during those 15 minutes. And then I will discard all of my supplies. Yeah, and then go document it after I've discontinued, and then I document again after I come back and check in 15 minutes. That's it.